R Mr. V mafia manager called Yakap from the Titi Kapi. Became a worse godfather than every other.
To TSL Nigeria and get updates on the go all day, every day. Subscribe to our YouTube channel on TSL Nigeria Space TV and join our online family.
And we are back. This is still the breakfast show only on TSL Nigeria TV. Now, drugs is any substance that changes an organism's physiology and psychology when consumed. While some drugs might be beneficial, others might be harmful. This morning, we're joined by a pharmacist, and we're talking about drugs, the usefulness, benefits, and of course, adverse effects. Good morning, Esther Chukuma. It's good to have you on the show. Good morning.
Good morning.
Good morning.
She is so pretty.
Thank you. Like pretty people. Anyway, you're fine.
I do.
Okay, so just tell us about yourself a little bit.
Okay, I'm pharmacist Esther Chukuma from Delta State, and I graduated from the University of Benin.
Wow, amazing. And so quickly, without much further ado, what are drugs? Now, I know from the pharmaceutical angle, there is how you define drugs.
Okay, pharmaceutically, we define drugs as any substance apart from food and water, which when taken into the body will cause a change in the body's normal function, either physically or psychologically. So that's drug for you.
Oh, amazing. And so, when we go to the counter to get drugs, right, sometimes we use the term drugs and medicine interchangeably. So I want you to clarify that. What's the difference between drugs and medicine?
Okay, there's actually a difference. All medicines are actually drugs, but not all drugs are medicines. What I mean is this. It depends on the purpose why you are taking that substance. Okay, when you're taking drugs, they either give you positive or negative effects. So when the drug is giving you a positive effect, like it's giving you prevention, it's giving you cure, it's giving you treatment, it's giving you improvement, then you call that a pharmacotherapeutic drug or a medicine. So that's what a medicine is.
Okay.
But when it's giving you a negative effect, like cocaine, heroin, marijuana, although they can still give you therapeutic effects, but there are certain doses that you take them. When you take them, then you get a negative effect, like you see the person unable to make right choices, is not concerned about his dressing, his judgment is just clouded because of that drug. Then you don't classify that as a medicinal drug again. You classify that as other drugs. As I said, all medicines are drugs, but not all drugs are medicines. But you can use them interchangeably. But it then depends on the purpose why you are taking that drug.
All right, that's wonderful. So I've always been meaning to ask this. I've always wondered, pharmacists, do they have the rights as per medicine to actually diagnose and prescribe drugs, or only medical doctors can do that? Because you go to some pharmacies and the pharmacist starts asking you your temperature, how is it? Okay, take 4, take 2, and you've not actually seen a doctor. So is it a job that is interchangeable?
Okay, professionally, the doctor does the prescribing, it does the diagnosing, and our job as pharmacists is just to look into this prescription that was brought before us. Are there any drug therapy problems? Is this drug working for a particular condition? And we make interventions. So we can actually intervene based on the prescription that was brought before. But we don't, professionally, our job is not to prescribe. But we have community pharmacy setting, like the one we see around, not in the hospital, community pharmacy setting. And the patient comes before you. It tells you, it brings his complaints, what he's feeling, and all of those. We have that jurisdiction also, based on experience that we've gotten. So look at those particular symptoms. And also, you have your nurse on ground, something like that in the setting. They do the vital signs to check your BP, check your sugar level, and all of those. And then we can, based on experience and knowledge, tell you that, okay, this is malaria. This is a symptom of malaria. And then we prescribe the drug for you. And all of that. But in an ideal setting, we should go to the hospital. Whenever we have any complaints, we should go to the hospital, see your doctor, then your doctor does the prescribing after diagnosing what's wrong with you, then you bring it to the pharmacist. Pharmacist looks at this prescription that is before, we, the pharmacist, will look at the prescription before us, and then we'll make possible interventions, counsel you on how you should use the drug. And that's all.
Okay, so
Juliet,
is there any point where you would say your body has adapted to a particular drug? Because sometimes we get sick, and maybe, let's use malaria for example, and we've been using Lonart for years, even when you just feel small headache, give me Lonart there. And then you, some years down the line, you have the same malaria, you've gone on your regular Lonart, and there are no effects whatsoever, and then at some point, the doctor tells you that your body is used to, that's the word they use, your body is used to this drug, you have to change. Is it the active ingredients in the drug that your body is used to, or?
Okay, I think what you are trying to talk about is resistance.
Resistance, yes. That's the term.
Okay, actually, you are not resistant to the drug itself. It's the organism causing the disease, that is the pathogen.
Yes.
That's what we call it medically, the pathogen. That organism causing the disease. That's what is the organism that's resistant to the drug. So we're actually talking about microbial resistance, not you, the individual, being resistant to the drug. It can happen. Of course it can. For instance now, most times we just self-medicate. Like, okay, I think I have malaria. I'm having headache. My mouth is bitter. I think I need to take a drug. And you go to the counter, you tell anyone there, please, I need Lonart. And you take Lonart. Sometimes you just like, okay, after a day or two, I'm no more feeling the symptoms again. Let me just stop the drug. And then you break your dose. You just end the dosage regimen, just like that, because you are a lot better. Over time, that parasite causing the malaria, falciparum, that parasite, it gets used to this drug. That's the artemether-lumefantrine, which was make up the Lonart that you talked about. It gets used to this drug, and you see that you start hearing words like treatment failure. I won't take Lonart again. It does not work for me. And you start seeing the doctor switching you over to another class, like they can give you Pialazine. So treatment failure can occur because of resistance. And the way we skip our doses, the way we abruptly stop our medication, we self-medicate and all of those things, resistance can occur. And it's actually very common with antibiotics. Most persons, you just see, I believe we advise as pharmacists, like, before you take any antibiotic, first of all, there should be a laboratory investigation where a test is done. It's called culture and sensitivity test. This test is done. It's like passing the different organisms causing the disease in you through a whole lot of antibiotics. And anyone that is inhibited, its growth is inhibited in the presence of this antibiotic, then you give that particular antibiotic. But most times, because these tests have not been done, we just go to the pharmacy and like, please, I need Augmentin. Or maybe you have malaria, you feel like, because I'm treating malaria, I must take Augmentin. No, that's not so. Before you use any antibiotic, you have to make sure that that test is done to find out the particular organism causing that disease. Then, not only the organism, a microbial inhibitory test is also done to find out the particular antibiotic that will cause inhibition in the growth of that organism. In that way, resistance will be curbed. But when we keep taking antibiotics without any reason for using them, resistance will always be on the rise, and you start hearing things like treatment failure.
All right, Juliet, let's hear from you.
To hear that. Okay, now over time, I've heard from people, doctors particularly, they've said things like all drugs have side effects. Even paracetamol, it has side effects.
Of course.
Now, I just want to know, are there any drug whatsoever that does not have any side effect that you could continuously take? For example, now vitamin C, it's good for the body. Is it like, what is the side effect exactly? Can't we keep taking it without having to worry about something popping up?
Okay, actually, every drug has a side effect. You know why? Because it's like a foreign body entering into your own body. You will definitely feel something different from the way your body is supposed to act. And vitamin C, based on how it is metabolized, how it is broken down in the body. That's what we mean by metabolism, how it is broken down in the body. The liver is actually where all of this occurs. So when you keep taking vitamin C, like, okay, because it's sweet, I can just take it like that now, you now take above the recommended dosage, then you start seeing that the liver starts overworking itself.
Vitamin C has recommended dosage.
Yes. No. Actually has. No.
Okay.
There should be. Sometimes the recommended dose in a day should not exceed, let's say, 1 gram, 2 gram.
What do you mean by 1 gram?
Like in terms of this,
we have
because usually we see 1,000 mg.
And that's 1 gram. Converting 1,000 mg will give you 1 gram.
Okay.
So that's what we mean.
Joyce.
All right. Okay. I think maybe if you try to address this thing, it's something that I think Nigerians are not taking seriously. Okay. Now, obviously, there are drugs that are over-the-counter drugs and drugs that are not over-the-counter. There are drugs that are prescription only. Why does it seem like it's easy to get drugs that are prescription only in Nigeria without a prescription?
Okay, we know the country we are in. In Nigeria, there are no laws.
Oh, God.
Actually, there are laws, but the laws are not working. Because if we really have good bodies regulating how medicines should be given, how medicines should be prescribed, how the pharmacists should give out these medicines, then we will not see problems in Nigeria. We won't. But actually, because, and most times you see that it's not really a pharmacy. I don't believe like you go to a pharmacy and because, where I worked before, in that pharmacy, you cannot just come and bring diazepam, which is a prescription-only drug, and say, I want to buy diazepam. No. We tell you, where is your prescription from your doctor? Because that's a poison.
It is?
Yes, all drugs are poisons, in quotes. So it now depends on the dose at which you are taking it. No, on the dose with which you are taking.
Change your 2 tablets of poison.
Talking about this, right? I studied microbiology in school, and so we did a course called toxicology.
Okay.
Now we started asking questions. I was pretty much inquisitive when our lecturer told us that every drug is a poison, and so she said when you take people that take paracetamol, talking about paracetamol, one of the basic drugs, and so when you take 6 tablets of paracetamol, your liver would be damaged on the spot, and so I feel that a lot of people do not understand the dosage and the number of grams, like you said, that they should take their drugs. And so how can we tackle this? How can we tackle recommendation and follow-up of your drugs? Because you talked about resistance. And when people are taking a particular drugs and they're taking it and it's not working, they keep taking it. What is the adverse effect of taking drugs that are necessarily not really working because the pathogens in your body are already resistant to those drugs?
Okay, like we said, the over time resistance will set in. Okay, but my advice is this: before you use any medication, see your doctor. Before you go to the pharmacy, before you even think about it, like let me go to the pharmacy to just get any drug, see your doctor. For every complaint you have, take it to the hospital. When you get to the hospital, they will run tests on you and they will see what you need and what you don't need. There are actually some conditions that don't even need drugs. Like stress. You might just have a little headache and you feel I must take paracetamol because I have headache. No, sometimes the body, all it needs is just rest. It just needs some non-pharmacological approach like rest well, eat well, and everything. Before you should take any drug, my advice, you must get to meet your doctor. And when you get to the doctor, most persons like, okay, in UBTH, where I'm doing my program, what they just do, the patients will just come in. They will see the doctor. Okay, pharmacy is the last place that you get to before you carry your drug to your house. And you just come into the pharmacy. You don't want to even have patience. In the next 2 minutes, you want to just go home, which is not supposed to be. When you come into the pharmacy, be relaxed, feel comfortable. Let the pharmacy do its job. Go through the prescription, check if there are any problems, make possible interventions, go ahead, dispense your drug to you, and counsel you. And in the process of counseling, pay good attention, because I think 2 days ago, I met a patient that was like, I gave the patient this particular eye drop to use. And I told the patient, take instill 1 drop 6 times daily. That's every 4 hours.
Yes.
And the patient, I was like, something prompted me to ask, Oga, how did I say you should take this drug? And the man was like, he said I should put 6 drops a day. I was like, no, that's not it. I said 1 drop, 6 times. I had to take my time all over again and break it down for the man. And then I was sure, I'm very sure that the man is doing the right thing right now.
Oh, 6 drops. In defense, using your UBTH as example,
okay.
You know, before you even finally get to the pharmacy, you're stressed. First of all, you go to GPC, and then you're there for hours before you finally see the general practitioner. And let's say it's something they can't handle, they refer you to the specialist. You can go to the specialist, you get there, and one nurse will just tell you that the doctor is not to have closed for this. Let's say it's 11:30. Then you start begging the person to consider you. You beg till 12. Before somebody finally takes your file, they do a processing for another 1 hour. Before you get to your pharmacy, you've spent from 9 a.m. to 2 p.m. at the hospital, and when you get there, you're just tired. But you know, that's just by the wayside. Is there a difference between a pharmacy and a chemist?
There is a big difference between a pharmacy and a chemist. First of all, for you to call a place a pharmacy, there must be a registered pharmacist on ground. A certified pharmacist on ground. But I believe if you go to the place we call chemist, patent medicine sellers, you won't see a pharmacist there. You won't see a licensed pharmacist there. So I believe before you go to any place, in quotes, medicine store, make sure there is a licensed pharmacist on ground. Okay. So that is what we should watch out for. Because if there is no licensed pharmacist there, my dear, you can take anything and go home. You can even take chalk inside a cover and go home.
I've heard cases like that. While we begin to wrap up this conversation, while we begin to wrap up the conversation, we're going to take some couple of comments. Blessing Hansen says, good morning. And she also says that the doctors are the ones who prescribe these drugs, because I've had experiences when I felt ill and the drugs I was taking was making me worse and weak until I stopped taking it and got better without it. Now, this is a form of question in the form of comments. How do you handle drugs you take that makes you feel worse instead of better?
Okay. First of all, if you are taking your drug in the right dose, as it was recommended by your prescriber, I feel it should give you relief. But if, peradventure, you are not seeing a relief, go back to the doctor.
Okay.
Go back to the doctor, give him feedback. Like, I've been on this drug, see the way I'm feeling, see what's happening to me. I believe if there is a need to taper the dose, like to bring down the dose, the doctor will do that.
All right.
So whenever you have any complaints, like you are taking this drug, it seems like it's making you, it's not showing you any improvement, there is no improvement in your condition, go to your doctor. Your doctor will always, if there's a need to taper the dose, he or she will taper the dose.
All right. We'd love to go on and on, but this is the point where we have to wrap up this beautiful conversation. Thank you so much, Pharmacist Esther, for coming on The Healthy Living. It was so much, and we learned so much. So this is it. This is all we are going to do on The Healthy Living edition. I'm the breakfast show this morning. Shortly, we're going to be having the one-on-one with Keremo Dukbe, and you will watch and see all that is happening in the country shortly after the breakfast show. We'll be here tomorrow for the weekend rundown, giving you all of the craziest news that happened in our own unprofessional self. We also have a blog, tsnigeria.tv. You can go there and get all the current trends on the go. Do well to download our mobile app on your Android and iOS devices. My name is Neki Moyo, and on behalf of Gillette, Onovai, and George Chooks, it's a wonderful morning. Have a beautiful weekend.